911 is the number to call anytime you have an emergency requiring police, fire, or an ambulance. Always call 911 when someone's health or safety is at risk. When a life is at stake, 911 is the fastest way to get the help. It costs nothing to call 911. The only time you may be billed is if you are taken to the hospital in ambulance or treated on the way to the hospital in the ambulance. This is because 75% of ambulance companies are privately owned and not paid for by public taxes. No, service is not free, but majority of your ambulance bill is covered by the Ontario Health Insurance Plan. When transported in a licensed ambulance, Ontario residents receive a bill for that portion of that bill that is not covered by your health insurance. This fee is normally $45. All Albertans, regardless of where they live in the province, pay the same rate for ground ambulance service in Alberta. The provincial rate has two fees: $250 if a patient is not transported, or $385 if a patient is transported. In Canada, a fee of $35 is charged for any additional patient for ambulance transportation for a person who does not live in Canada. The basic fee is $400 plus $1.75 per kilometer traveled. Rates may be indexed annually. In America, the cost can be nothing out of pocket in cities where services are covered by taxes, but usually ranges from less than $400 to $1,200 or more plus mileage. In NSW, ambulance cover is managed by private health funds. However, if you have private health insurance, your policy may not cover the cost of an ambulance, as this is dependent on the level of your cover. NSW ambulance services are provided at no cost to you if you are covered by a private health fund. If you feel you are having an emergency and call 911, Medicare will cover the transport. Your senior care 911 ambulance membership covers your 911 ambulance transportation for a full year. Medicare only covers 80% of the Medicare allowable amount, with the patient responsible for the rest. Ambulance service in Ontario is covered under OHIP, and all patients have to pay is a co-payment fee of $45. However, if the ambulance service is deemed medically unnecessary, patient gets slapped with a bill of up to $240. You are responsible for an ambulance service co-payment charge of $45 for ambulance services rendered if the following conditions are true. You are a resident of Ontario, you have a valid Ontario health card, a physician deems your ambulance service medically necessary. One of the very first thing they teach us in EMT class is that as long as the patient is conscious and alert and capable of making coherent decisions, the patient always has the right to refuse to be transported, regardless of who called 911. Forcing someone to go to the hospital against their free will is similar to kidnapping. Responding to a rescue call and having a patient refuse transport is pretty common. But if you are unconscious or did something intentionally in an attempt to seriously injure yourself or others, then the choice is no longer yours. The law tells EMTs that anytime someone is unconscious, we have what is called implied consent, meaning that the law makes the assumptions that anyone who is unconscious would want or need to get medical attention at a hospital. But when I say that someone who intentionally injured themselves, I don't mean accidents like a person playing five-finger fillet, where you put your hand out with fingers splayed and use a knife to hit the table or ground in between your fingers with a knife quickly while not trying to cut or impale their own fingers. I mean situations where an individual intentionally tries to do something that they know could result in a life-threatening injury or death. So as long as you are conscious and alert as well in your right mind, you have the right to refuse transport. But if we think the illness or injury will soon cause you to become unconscious or not in the right state of mind, don't be surprised if the ambulance crew stays with you for a while so that they can get you treatment by transporting you after you're unable to make the decisions on your own. In the US, anyway, there are only a few limited circumstances where you can be made to go to the hospital against your wishes. One, if the patient is under the influence or alcohol or drugs. Two, if the patient is unconscious. Three, if the patient is in a danger to themselves or others. Let's say you've just stopped yourself in a suicide attempt, but you're refusing to go to the hospital. If the patient is under police custody, a person who has been injured in a car crash is under arrest for DUI. The cops can make the person go to the hospital. Outside of those circumstances, nobody is going to make you go to the hospital, regardless of your reasons. And yes, I've seen plenty of people in my career who have refused to go to the hospital, who have ended up dying right after we left. Sometimes it happens. As long as you are what we call alert and oriented times 4, meaning you can tell me who you are, where you are, what the date is, and what is happening at this time, and why you think we are or we were called to the scene, then you have every right to refuse treatment and or transport by EMS. They should have you sign what is called an SOR, signature of refusal, which says you understand we aren't doctors and that you are taking your medical care in your own hands. Also, the consequences of not going by ambulance could be further illness and injury up to and including death. As long as you sign that form, an EMS professional cannot take you against your will. Taking someone against their will, unless altered, can be considered battery and kidnapping and can cause the EMT or paramedic to not only lose their certifications, license, but also could result in fines and jail time. Well, it may vary from ambulance service to ambulance service because all operate under a different medical director. However, for most part, you just tell them you refuse treatment transport. As long as you are awake and oriented and understand some conditions, injuries can result in your death. If left untreated, then you can refuse. Now in my area in Florida as a medic, we had to call medical control for the doctor on call to authorize the refusal. Alberta declared a state of public health emergency. New public health restrictions come into effect starting September 16 to reduce spread and protect our health care system. Businesses participating in the restriction exemption program will require patrons to be vaccinated or show a recent negative test result. Getting vaccinated is our best defense to beat COVID-19.